Picture this, your loved one survives a life or death situation, and as they improve, the hospital sends them to a nursing home more than 100 miles away. That's what's happening to families in our community as overcrowded hospitals desperately try to free up space. News 10 NBC investigative reporter Jennifer Lukey shows us just how far they're willing to ship people who no longer need acute care.
Liz and Ski Dombrowski have been married for more than 50 years. They've never spent a birthday apart. But instead of waking up next to Ski on the day he turned 75, Liz had to drive 2 hours away to see him.
I made cookies instead of a cake because cookies would be easier.
Around Thanksgiving, Ski had complications following a heart surgery. After 3 months at Highland Hospital, they told him it was time to go to a nursing home. The problem? The closest available long-term Medicaid bed for Ski was in Horseheads, Chemung County, 120 miles away from his home in Spencerport.
It's all about the money. It's all about the profit.
Did they tell you if you could private pay, you could get them anywhere?
Oh, yeah. Or I could bring them home.
But Ski can't stand or walk on his own. He needs rehab, so there was no other option. He was sent to the Southern Tier.
It's a long trip.
It is. We're maybe halfway there.
I took the drive down with Liz to get a feel for how that choice has impacted her family. Instead of visiting him every day, Liz is lucky to see her husband once a week.
It was so easy.
And every visit is emotional.
With tears running down my face.
It's your birthday.
It's my birthday, 25 times 3.
Ski has no complaints about the facility he's in, but
The thought of you being in Horseheads, how did that settle with you initially?
Not good. Not good at all. I actually fought it. And I said, I'm not going.
But it was this or nothing.
I said, come on, all the nursing homes and places that are in Rochester.
Sally Rousseau is the director of social work at Highland Hospital.
We are a community in crisis.
She and her team are tasked with finding nursing home beds for hospital patients who need them. And to say those beds are in hot demand would be an understatement.
They receive upwards to 400 referrals a day from our local hospitals, vying for those available beds.
400 people in our community looking for a nursing home every single day.
Is it basically just whoever has a bed, or and how far out will you go?
A lot of it depends on what the patient needs.
Sally says they start with the patient's home county, but then
If it's been out for a week or more, it's usually all of New York State. And we have had to place patients as far away as New York City, Lake Placid, and other parts further away.
meaning Ski's situation isn't unique. Unless, of course, the patient isn't on Medicare or Medicaid.
So, Sally, is it fair to say that if I have $200,000, $300,000 in the bank and I need a nursing home, I have a much better chance at getting one closer to home than someone who's on Medicaid or who is on their way to Medicaid?
Absolutely, and it's understandable. Nursing homes need to be paid for their services, and actually they need that case payer mix also.
We know the Medicaid reimbursement rate doesn't come close to covering the actual cost of care. So the nursing homes have to limit how many people on Medicaid they take.
I think this is the tip of the iceberg of this issue. It's not going to go away.
And it has real-life consequences for people who will need care for the rest of their lives, and for those like Ski who are trying to get well enough to get home.
For Thanksgiving, Christmas, New Year's, our 54th wedding anniversary, and now my birthday. It's just, I can't believe I've been gone from home so long.
Ski is doing rehab. He's hoping he can get home to his family by July. So where do we go from here? How do we open up more nursing home beds in our region so families aren't faced with this? Coming up new at 6, we're going to dig into that. What the state is doing to up those reimbursement rates for Medicaid patients. We're going to go straight to the lawmakers to get some answers. Brett.
Boy, that's got to be difficult for that family. All right, we'll look for that. Jen, thank you.